What I'm going to go over today is pediatric traumatic related or traumatic injuries. Typically, this is going to be from what we're going over. It's going to be more along the lines of a fall. Something I think is pretty important that I went over today is the PCARN formula, which it looks like it's all backwards. So, but the PCARN formula was essentially created by, and you can get the medical stuff on Amazon too. So that's pretty, you'll be able to get that stuff. But the PCARN criteria was developed by a ton of different children's hospitals and hospitals that specialize in pediatric trauma. Essentially, what that criteria is exactly is it determines whether or not a child is going to end up getting a CT scan or not based on how significant the head trauma is. So based on that criteria, the PCARN criteria, any child that's less than 2 years old and any child that's 2 years old, either 2 years old or older, is going to receive a little bit different different kind of like grading, all right, as far as how they're rating that system. The first thing that they look at they want to rule out any super high risk issues, obviously, because when you have a child that has an issue like a head injury where the kid looks like they might need to get a CT scan, they're going to be going in for that high risk thing immediately. You want to rule that out, and that goes with literally anything. On any assessment, you're going to be wanting to rule out the serious things first. And how they do that is essentially they're looking for, does the kid have a GCS of 15 or more? And looking up how to determine a GCS, if you're not familiar, is a pretty important thing to do. Whether you are an EMS or you are just, on the street, just wanting to be a better member of society and know these things because, you're around kids, or you might, have, you just want to help people, and that's fine. That's awesome. But knowing what a GCS is, which I'm not going to go into details on what that is exactly, it's pretty easy to calculate. It pretty much goes from 3 to 15, 3 being the worst case scenario, which would be completely unresponsive, and 15 being like you're running around talking, having a good time. It doesn't necessarily have to be walking around having a good time, but you're, conscious and alert and everything like that. Then we're going on to, is the child's mental status altered or not? And then what that means for that age range. Because if you have a child that is 2, right, their level of consciousness is not going to be the same as a child with, that's like 5 years old or so. Now, that's something where you're looking at now skull fracture signs. So can you immediately see signs of a skull fracture? All right. Now you look at a kid, the kid fell 6 foot off the monkey bars and hit the ground, and you're like, damn, that kid fell on some concrete and now they're not moving. That goes in along the lines of that is more of a serious thing. And that also goes with mechanism of injury. So how serious was this accident that happened? Did the kid fall while he was running around and then fall from standing height, or did the kid fall from 6 feet, which is more than a kid's total length of their body? So that's double, if not triple in some circumstances. Intermediate would be they might be getting a CT scan, and then they're looking for loss of consciousness, vomiting, upset stomach, stuff like that, where it wouldn't really make sense. The kid fell and now the kid's complaining of nausea, and now they're vomiting. Severe headache, obviously we're looking at where the kid was hit on the head, and then we're looking at more severe mechanism injury. And then low risk would be none of the above, low risk for CT. I am glad that you asked that question. Should you let them go to sleep or not with head injuries? Very important question to ask. Which is from the time that I was a little kid before I got any medical training, that's oh my God, that kid, don't let them go to sleep, or don't let that adult go to sleep. The reason why they're talking about do not let them go to sleep is, now, if you have kids and you don't have kids, if you've ever been around a kid, you know a kid, you've seen a kid in the wild, kids are wild, right? People as well, people are running around, and at what point would you go from being extremely excited to wanting to go to sleep? You wouldn't ever have that happen, right? I mean, unless you're doing some crazy stuff, where I mean by that is like you're going out running like a freaking multi-day run, and you are, but that can be explained. Where we get into the weeds is, can we not explain this kid's actions? Can we not explain this kid's behavior? Is this kid acting abnormal? Those are serious considerations, and that's why I wanted to go over the PCARN criteria, right? Because if your kid is at the playground, excited, having a good time, and they fall and they hit their head, and now they want to sleep, probably should try and keep them talking. Now, you don't want to, keep them awake and smack them and stuff like that, but that is something to pass on to the medical professionals. And all these things that I talk about are recommendations. They are not protocol. They are just things that I have researched on my own and things that I've learned throughout being a paramedic for quite a while. Now, we've gone over that criteria, and hopefully that answers your question. We've gone over that serious criteria, which I wanted to hit on. Now I want to go over, the beginning, like what we're going through, the beginning of like an actual scenario, and then I'm going to walk you through it, and we're going to make a decision, and we'll be having a good time, I think. So here's the scenario. We have a 6-year-old playing on a playground, climbing the monkey bars, and falls about 6 feet. Okay. Now, we all know, like, this kind of stuff happens. Like, kids fall off stuff, whatever. Like, it happens, right? That's what I don't want us to think like, or how I don't want us to think like. Because the kid lands hard on its side, they scream and they cry immediately, which is actually, a reassuring thing. It makes us feel better as adults. After about a minute or so, the crying starts to slow. They sit up, they say they're okay. As a parent, or somebody standing close by that just saw that kid, you're going to be like, man, that scared me a little bit. Ask the kid, like, are you all right? Kid nods at you. Yep. Most people, they relax right there, right? Well, let's take a pause. Before we start to relax, and I'm not trying to, create, paranoia, but before we relax, let's take a deep breath and let's look over this kid, and let's kind of evaluate what went on. Okay, a 6-year-old fell off the monkey bars, let's say 6 feet, hit the ground hard on its side. What are we looking at right now? Okay, and something that we need to take into consideration is, like I was talking about earlier, mechanism of injury. The key points of your skull, okay, that make up the anatomy of your skull as an adult are different that would make up the anatomy of a child in regards to how hard the skull is in certain areas. Has the skull completely closed up at that point? Little things like that. The way that the kid's anatomy is going to be from an adult, kid's body proportions are different, things like that. Now, if you have a head injury, and even as an adult, and this is kind of relayed to me as this like description like this, where you're at like a party and you take a beer can, you crack it on your head, and that's really not going to cause a significant injury, because your head is meant to take impact in this area, or it will take impact better in this area, right, than it would if you jammed it on your temple. And that is because on your temple you have a lot of vasculature. You can take a temporal pulse. You can feel your temple right now, and you can feel that your heart is pumping. Okay. You also have the back of your head, which in a child, there's only a couple, millimeters or so that make up that portion of the skull. So if the kid lands on its side and hits the head right here in this temple area, think internal bleeding potential. Okay, now that is where that comes into mechanism of injury, and we're looking at, okay, now this might be a little bit more serious. With kids that answer appropriately with no blood, no obvious injury, crying has stopped, everything looks okay, right? But over the next few minutes, small things start to change. All right, the kid is very still. they say their stomach hurts. Abdominal pain is a red flag that we were talking about, right? That nausea and vomiting. And now they lean against the parent. They're weak. Like you were saying earlier, like, should I let them go to sleep? The kid was just playing. Now the kid is all of a sudden altered. That is a red flag. Okay, they're quieter than normal and their mental status changes. So from, a parent, a babysitter, whoever who's watching out for a kid, and then all of a sudden they fall and now they're altered, that's pretty concerning. No screaming, no drama, the kid is just different. With kids, the behavior tells the story. So with children, with the elderly that suffer from neurological issues, and that's what I would be thinking. Rush them to the ER. See, you're thinking that's where I want you to think. I want you to think this is serious. Behavior tells the story. Watch out for those minor changes. Okay, inside the child's body, something may be bleeding. Like I was saying, they landed on their side. On their side, you have a lot of vasculature running on the temple, and you also have a thinner portion of the skull, and that can cause internal bleeding, which can cause pressure on their brain, and then cause nausea, vomiting, fatigue, all sorts of issues that obviously we want to keep an eye out because we don't have a CT scanner, with us at the moment, and that would meet that criteria that we were talking about, where now we're looking at this kid has a serious issue enough to get a CT scan. And the reason why they made up that formula is because they want to make sure that not every kid is getting a CT scan, and they do not want to expose the kid to unnecessary radiation. Just doing some research on that PCARN formula or PCARN criteria, that is something that is extremely important. Kids can injure their organs without breaking bones. Obviously, they are still they are still growing. Their bones are more flexible, and that is something that we need to watch out for. By the time the kid looks really sick, they already are. Kids compensate until they don't. Kids have a very short window there, so their body will compensate pretty well, and then it'll be like this. Oh, we're compensating, boom. So it's very important to assess the kid when something like that happens, and then constantly reassessing for any changes, such as a little change could mean something very big. This is what makes pediatric trauma so nerve-wracking for first responders. This is what makes pediatric trauma nerve-wracking for parents and for anybody in general. 10 to 15 minutes after the kid fell, the kid looks pale. They say they're tired. They don't want to stand up. Parents say, you were just fine a second ago. Exactly. They were just fine. They were compensating. And now all of a sudden, boom, they are going down the drain. This didn't just happen out of nowhere. It's been building up quietly. Kids don't decline slowly. They hold until they fall off a cliff. Pediatric deterioration is fast. Here's why it matters even without medical training. If the kid falls hard, behavior changes, pause. Behavior matters more than words. Don't force them to stand up or walk it off. Movement can worsen injuries. Sit them down or lay them flat. It helps with circulation. Keep them warm. Kids lose heat fast. Call for help early. So when we say grab the kid, take him to the ER, hold on a second, okay? That might be the best case scenario in something like a bleed, okay? But with any kind of head injury or spinal injury, we don't want to jostle the kid, move him around, and flop him around because it could make the problem worse. Until they can get appropriate assessment by a medical professional, that could make the issue even worse. Call for help early. If you saw your kid or a kid fall 6 feet off of some monkey bars and land on their side, that's a pretty significant injury. That is a pretty hard fall, and that is something that definitely deserves to get checked out by EMS personnel. You don't need to diagnose it. You just need to respect the signs. For parents and civilians, this is awareness. For military, police, fire, EMS, this should just sound familiar. This is just something that you should keep in the back of your mind, something that I think is very important to everybody to be aware of, and don't rush it. Behavior change is a vital sign. Kids show problems differently. Like I was saying, even in the PCARN criteria, there are different criteria for different ages, and that is because we don't know what the baseline is for a 2-year-old versus a baseline is for 2 and above. And that we can't generalize. That's what I mean by that. You can't generalize something like that because a kid is going to respond differently, things like that. That's why it's very important. When I get on scene, I ask the parents, I'm like, hey, is your child acting normal? Have you noticed any changes? We don't even know the child. Does the kid have, developmental delays or anything like that? We don't know. Is the kid, is the kid nonverbal? We don't know. Now, those are things that definitely make an assessment a little bit more tricky, but those are things that we need to keep in mind because those are vitals that are not going to necessarily present like a normal, everyday child that we would encounter. So those are things that we need to keep into consideration. And those are things that we, as medical providers, when we arrive on scene, are like, okay, this kid can't talk to me. This is just another reason why the kid needs to go to the ER and potentially get checked out by a physician and potentially get a CT scan, because if they can't verbalize anything to me at 5 or 6 years old, maybe they do have something else going on and they just can't tell me. Okay, and that also goes with the elderly as well. That's why I asked the kids or whoever's taking care of the elderly patient, hey, what's normal, what's not normal for your child. Normal numbers early don't necessarily mean safety. Kids compensate until they crash, and I'm gonna keep on hitting on that because kids compensate until they just tank. Reassessment isn't optional. It's how you catch things quickly. So those are some pretty important things. Kids don't need to look hurt to be hurt. Appearances lie. Crying isn't always bad. Stopping suddenly can be. So those are one of those things that changes matter. Quiet kids after trauma are concerning, not comforting. If a child's behavior changes after a fall, listen to it. This isn't about being afraid to let kids play. It's about knowing when to slow things down, when to take a tactical pause. Most kids are fine after falls, but the ones that aren't don't always look like it at first. If this helps you, pause 1 extra minute next time, and it did its job. So now I'll look at some of the questions, and I'll review some of the stuff that I have on the on my dry erase board. So I'm going to go back up. So how rare or common is it for a change? Is that what you're asking? Okay. Yep, call for help early. Don't move them. Yep, you can look for bumps and bruising. So that is something that I wanted to go over as well. So when you're doing your primary assessment, okay, you want to assess for, it's called March, okay? You're looking for any massive hemorrhage, all right? You're looking for a change in their airway. You're looking for equal and good respirations, like normal. Circulation is another big one. Now, something that, I actually talked to my doctor today, my medical director, and, he brought up a really good point. And one way that we can assess circulation on anybody is capillary refill. What that means is you have your hands or, whatever on your body, and you press down and it should be white for a second, and then all of a sudden it goes back to a normal color. Now you're looking for that change to happen within about 2 seconds. If it's taking longer than that, that can be an indication that they're not getting good equal blood flow throughout their body, which is called perfusion. Now, something that you need to keep in mind when checking capillary refill is the temperature outside. If your child or you are cold, capillary refill is going to naturally be slower. No changes can be common, and then all of a sudden they change rapidly, and that's something that we need to keep in mind. And let's see what Mike said. So as a responder, use the setting as sign 2. The environment, is it chaos, clean, suspicious? Those are things to definitely keep in mind for sure. Now, so I've had, the question with urgent care or in 911 and go to the ER appropriate. If you have a child that has fallen, okay, and it's a pretty significant mechanism of injury where they are, and we were talking about this a second ago with when a kid falls and they hit the side of their head or the back of their head, those are two pretty critical areas. If a kid hits the side of their head or the back of their head and they are not acting like normal, the most appropriate place to go is going to be the ER. And the reason why it's going to be the most appropriate place to go is because not only are they going to have a CT scanner, but they're also going to have surgical abilities versus an urgent care, which might have a CT scanner, but then what they're going to have to do is they're going to CT scan the kid, and then they are going to take them to the ER anyways. This is also a decision that you're going to need to make because it just depends on how far the urgent care is away from the emergency room. If you take your kid who's fallen, who is now altered and showing those red flag signs like I was talking about, which would be a GCS lower than 15, altered mental status, skull fractures, significant bleeding, stuff like that, you could take them to an urgent care for them to get stable. And that's like if you haven't called a paramedic or you haven't called 911, they will make that decision once they get there where they're going to take them to. And most likely they're going to be taking them to an ER. They're not going to be taking them to an urgent care because they know and they're trained to know exactly what criteria which medical facility has. And they will take them to the most appropriate facility that they possibly can. With that, like going back into the primary assessment, if they're talking, if they're breathing, and if they're perfusing, those are all good signs, like I was saying earlier. If you lose one thing changes, you reassess everything. If one thing changes, you go ahead and you reassess everything that you've already looked at, okay? If the kid is, say, another thing that we kind of went over with, I went over with my medical director today is, he was talking about kids and what's called handlebar injuries. And with those handlebar injuries, we're talking about kids riding a bicycle, kid crashes the bicycle and hits their abdomen. These are not necessarily common in adults, but they are common in children. And what happens is internal injuries to their like GI area are a lot more common because they will strike with where the handlebar is at in their abdominal area, and it can cause some serious tenderness. It can cause liver lacerations within, which can cause internal bleeding, and those things can be pretty significant. Something that I want everybody to take away from this today is a calm child does not mean they're okay. A quiet child does not mean that they are stable. And be aware of delayed deterioration. So once a kid starts to deteriorate, it's already pretty bad. Silence is a symptom. So always remember that if a kid is not responding like normal, it is a symptom, and those are things that you need to be aware of. A calm kid can also still be a sick kid. And those are all extremely important. Always reassess, and time does matter. So once you've established that the significant thing has happened, significant mechanism of injury, whatever it may be, getting them to the appropriate care and getting them to a hospital is going to be obviously time sensitive. So do we have any other questions?